Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Well, good morning, everyone. We have another edition of the Cardinal Minute today on Thursday, February 20th. Today, I have the privilege of having with me Dr. Alex Carll here from the Center for Cardiometabolic Science and the Christina Lee Brown Envirome Institute in the Department of Medicine. Dr. Carll today presented a really fascinating discussion of the impact of e-cigarette use on cardiac electrocardiographic activity. So today's discussion was really quite stimulating, Dr. Carll, so much so that we had extra questions that were still coming in after the lecture ended. And I'd really like to lead with that question, which I think is quite relevant. So Dr. Bishop was asking, as a MedPeds hospitalist, she sees a lot of her adolescent population, but even younger and younger, that actually has evidence of e-cigarette use. Do you have any evidence or insight or perhaps some speculation as to the impact that using e-cigarettes at an even younger age may impact ultimate outcomes?
Yeah, our evidence for that is pretty limited, at least in mice, and part of that is owing to the limitations of implanting these radio transmitters in mice that are any younger than 10 weeks of age. But there is sort of precedent for belief that youth are going to be more sensitive, and that's especially on the basis of comparison to infants, for instance. There are several studies that have shown that secondhand smoke exposure in infants, exposure to ozone or other sort of ambient air pollutants evoke arrhythmia responses as well as arrhythmogenic responses, being like a slowed ventricular repolarization at relatively modest levels. And so there is some evidence that that the younger you are, the more sensitive you're going to be to really any aerosol or irritant gas, and e-cigarettes are just that. They are an aerosol with a number of irritant gases within them that could very much have enhanced impact in younger individuals, not to mention the presence of nicotine itself, which is likely to be more potent in them as well.
Great. Thank you so much. So if you would like to hear more from Dr. Carll and learn more about the research in his laboratory, make sure you watch the full-length Grand Rounds that was delivered this morning. Thanks, everyone.